Dr. Calarco, I really appreciate you joining us today. And just to get started, why don't you introduce yourself?
Great, it's a pleasure to be here. I am currently the Director for Clinical Innovation at the University of Michigan School of Nursing. But prior to that, I was the Chief Nurse Executive at the University of Michigan Health System for 17 years, and I retired from that position at the end of 2017.
I know you know quite a bit about the FACES Foundation and the Phil Award,
Mhm.
being the first organization to partner with them. Could you just give us a little bit of an explanation of what the FACES Foundation and the Phil Award are?
Sure. The FACES Foundation really supports caregivers and patients with respiratory illness, with a particular focus on honoring respiratory therapists with what's called the Phil Award. The Phil Award was developed by the FACES Foundation founder, Sharman Lamka, in memory of her husband, Phil, who passed away, I think, in 2005 from a respiratory illness. Sharman wanted to do something to contribute to the ongoing development of work in respiratory illness and care. And she wanted to honor respiratory therapists because during Phil's stay in the hospital and throughout his journey in terms of his illness, he was cared for by many respiratory therapists, and she wanted to honor their work.
Now, as I mentioned before, I understand that your organization was the first to be a partner with the FACES Foundation,
Mhm,
which you were intimately involved in.
mhm.
Why did you decide to partner with the FACES Foundation at that very early stage?
Well, we have a long history with Charmin. Charmin actually brought the Daisy Award to the University of Michigan Health System. The Daisy Award, as many nurse executives know, is the honorary award for extraordinary nursing care. And again, in terms of the care that Phil received in our hospital and in our intensive care unit, Sharman was the one who actually found out about the Daisy Award and brought it to me because she wanted to sponsor our nurses in terms of honoring them. Our first Daisy Award was given in January of 2007 by Sharman, and Sharman has remained the sponsor of that award all these years. It's through her generosity that we actually have been able to honor nurses. And as we were doing that, Sharman was also developing a similar uh, contribution to respiratory care and also wanted to develop a similar award honoring respiratory therapists. And so it was just a very likely partnership that we had. We knew how the Daisy Award was helpful in recognizing the unsung heroes of the hospital, and respiratory therapists as well are really unsung in terms of the care that they provide. So when Sharman approached me with the FACES Foundation and with the Phil Award, we were thrilled to be able to partner with her and to provide some acknowledgement for our respiratory therapist staff.
Great. Now, you were at the time the chief nursing officer. How did you present this and partner with the respiratory therapy department uh, as far as presenting and then supporting the award?
Well, what the respiratory therapy department did report to me organizationally as the chief nurse. And so I had strong relationships with the department, and we have very large departments, both in our children's hospital and our adult hospital. And so it was an easy discussion with the directors of respiratory care in terms of being able to acknowledge the staff. So everyone was very excited to be able to provide that acknowledgement. And we started out with one award annually that was identified by patients and families. The first award actually was a respiratory therapist who cared for Phil during his stay, just like the first Daisy Award was for a nurse in the ICU that cared for Phil. So that was a very easy transition. The staff were thrilled with being able to celebrate their profession. And so we continue that. Now, the Daisy Award is given twice annually, one for our children's hospital and one for the adult hospital.
Logistically, who's responsible for overseeing the program, and what role? I know that you're no longer in the role of chief nursing officer. What role does the chief nursing officer have as the award continues to evolve within the system?
Well, the person who's operationally responsible for providing all of the celebrations related to the Phil Award and for the selection is the director of respiratory care. We have two directors, one in our children's hospital, one in our adult hospital. My role had been, and the chief nurse's role now, is really just to continue to show support of the award. I always attended the award celebrations, acknowledged the respiratory therapists in our communications through leadership, and we acknowledge the Phil Award organizationally as well, so that individuals across the hospital could recognize our respiratory therapists for the Phil Award and for the work that they do every day.
Understood. Now, you were the first and also the longest FACES Foundation partner. What has kept you and the larger organization continue to be a partner of the FACES Foundation?
Well, we always look for ways to be able to acknowledge our staff in multiple ways, in many ways possible. The Phil Award is really the first and I think the only actual recognition of respiratory therapists across the country. And so it's something that we plan to continue to sustain for many, many years. Again, respiratory therapists are often not understood in the healthcare environment, the unsung heroes of healthcare and respiratory care, and really, especially with the COVID-19 pandemic, respiratory care has come to the forefront of caring for patients and their families throughout this horrific challenge. And so, more than ever, respiratory therapists need to be recognized and acknowledged for the wonderful work that they do.
Absolutely. I'm sure over the course of the years, you've heard some amazing nomination stories. Would you be able to share maybe one that you remember that stuck in your mind over the course of the time?
Well, the one that actually sticks in my mind is the first one, and that is because, again, it was for Charmin's husband. And I remember Charmin talking about Phil's care in our ICU and how the respiratory therapist would do small and very specific things to make him comfortable. He had interstitial lung disease, and at the end of his life, it was very, very difficult for him to breathe. He really could not do the simplest of tasks. And at one point in the ICU, he was having difficulty breathing. And so the respiratory therapist turned his bed, he actually turned him on his stomach. In addition, the device that he was wearing to breathe really was uncomfortable for him. And one of our respiratory therapists searched the hospital for a mask that would cover his face, but allow him to get his oxygen as efficiently as possible, but also as comfortably as possible. That just is a reflection of what our staff do every day to make individual patients as comfortable as possible. And so that's a story that's always stuck with me.
You talked about the recognition of the respiratory therapists with the use of this award. Could you talk a little bit more within your hospital system specifically, how it's helped as far as increased recognition, whether it be with peers, staff, or with patients due to the existence of this award?
Well, the award always provides an opportunity to celebrate not only for the individual receiving the award, but we do that celebration with all of the staff together. And it's actually a surprise announcement. So the staff all gather. We usually have food. We talk about the Phil Award, we talk about respiratory care and the wonderful care they provide. And then we announce the recipient, which is always fun for everyone. And everyone is so excited and supported to be able to support their colleagues. We have some of the leadership also join us at times. And again, that just provides opportunity for the entire staff to be able to be recognized by the organization. So it's been a wonderful opportunity for us to come together and celebrate the professional care that's provided.
Well, I think it's amazing the support you provided as the CNO as far as the initiation and the continual partnership with the FACES Foundation with respiratory. I want to ask your opinion as far as what you would say to other CNOs that oftentimes respiratory departments report to, who are hearing about the FACES Foundation here for the first time, or maybe they've heard about the FACES Foundation but haven't taken any action yet. What would you say to them about, the benefits of partnering with the FACES Foundation?
I think that, as I said before, many chief nurses know the DAISY Award and are familiar with the DAISY Foundation. So we know how that has contributed to nursing celebrations, and the acknowledgement of nursing at the bedside. And the FACES Foundation is another reflection of that and an opportunity to do the same for our respiratory care colleagues. And we all recognize what our respiratory care colleagues do day in and day out. And I think most of us would welcome an opportunity to partner with the FACES Foundation to be able to provide that type of recognition for all of our staff.
Great. Well, I appreciate your time, Dr. Calarco, today. Before we close out, is there any last comments that you have?
I would just like to encourage my chief nurse colleagues to really think about partnering with the FACES Foundation. As I said, it's provided an opportunity for us at Michigan to come together and celebrate our respiratory care colleagues, but we come together as a team. And so the entire team is able to come together and celebrate the wonderful work that our respiratory care colleagues do. So I would just encourage everyone to think about partnering as you move forward.
Great. Well, thank you very much, Dr. Clark. I really appreciate the time that you provided us today.
Thank you.